Hi, my name is Javier Sanchez, and I've worked in youth prevention for over 20 years now. I love what I do, and I get so excited when I travel around the country and I meet so many young people that are declaring that they are not going to use alcohol, tobacco, vapes, cannabis, and other drugs. And it's inspiring and encouraging to me. But I also know that there are young people that do choose to engage in those behaviors. But here's what we understand. Anytime that there's an increase in access to substances and a decrease in perception of harm and risk, the likelihood that more people will engage in that behavior really goes up. So how do we get our kids as parents, I've been a parent for over 20 years, how do we get our kids to declare no? And I'm using the word declared very intentionally, because here's what I want you to understand. There is a difference between a declared no and a directed no. We know as parents, when we direct our kids not to do something, you can't do that, you can't go there, you can't have that. A lot of times it's met with resistance and pushback, right? And that's just how our brains as humans are wired. When we're told no, we can't, our brain automatically goes into yes, I can, right? What we want to do is get our kids to declare no for themselves because they recognize the value and the benefits of making that stance and taking that stance not to use alcohol, tobacco, vapes, cannabis, and other drugs. So how do we do that? I learned early in my prevention career about the 3 phases of adolescence and how in each of those phases, we can encourage kids to declare no. Those phases are the learn it phase, the like it phase, and the live it phase. The learn it phase is from age 0 to 10. That's where when they learn that something's gross or bad or unhealthy or disgusting, the likelihood that they engage or in that activity or that behavior, it significantly drops, right? So if we teach them it's gross to drink alcohol or use vapes or use tobacco or use cannabis or other drugs, and we can show them in an age-appropriate way why it's gross, why it's disgusting, why it's unhealthy, learning that is usually enough for them to declare no for themselves. The next phase is that 10 to 14 year range when they're in middle school. That's the like it phase. And the reason they like declaring no is because they're being rewarded and celebrated. In middle school, there's a lot of drug-free clubs and positive choices and healthy living activities where they can get involved in experiences and be celebrated and encouraged and even rewarded for making the choice to declare that they're not going to use alcohol, tobacco, vapes, cannabis, and other drugs. And we can do that at home. We can celebrate them, we can encourage them, and we can even reward them when they make healthy, positive choices and declare no, right? And then that next critical phase is that 14 and up phase. That's the live it phase. That's when they're learning what they live for, right? They're learning what their identity is, who they are, where they're headed, what their story is, what they're known for, and like I said, what they live for. And in order for them to declare no at that age, they have to have a significant connection to 4 things. They need to have a significant connection to somewhere, somehow, something, and someone. Somewhere is hope for tomorrow, goals, dreams, aspirations, places they're trying to get to. Somehow is a plan to get from where they're at right now to where they aspire to go. And if we have a conversation, if we're having conversations with them about their somewhere, their goals, dreams, and aspirations, and there somehow, we can help them create a plan and help them understand, okay, here's a list of things that will help you get closer to your goals and aspirations, and here's a list of things that can disrupt or become barriers or obstacles to you accomplishing your goals and aspirations. Something is something, a connection to something bigger and beyond themselves, a higher power, a higher calling, a higher purpose. When they're connected to something bigger and beyond themselves, they're less likely to engage in dangerous or risky behaviors. And then that last one is really important, someone. And that someone, and I want you to hear this, parents, is a non-parental, non-judgmental, caring adult. Be it a teacher, a coach, a mentor, a counselor, a family member that doesn't live inside the home, a non-parental, non-judgmental, caring adult that can help connect them to their somewhere, somehow, and their something. As parents, that should be our goal. We want our kids to live happy, healthy, and productive lives and to declare no for themselves. And so I hope this information that I've shared with you will help you do just that.